And thank you all for having me. I'm Kate Woomer-Deeters from the North Carolina Justice Center, and I have my coworker Stacy Borello here with me as well, who's going to speak. And many of you have seen me present on these topics before and have met me before. And so what we're going to talk about today is what is happening in Congress. And so I'm not going to give an hour-long lecture on who's eligible for benefits. If for some unknown reason you haven't seen me give that lecture already, let me know. I'm happy to come speak to different groups, and I'm happy to do that. But today we're just going to talk about what could be possibly changing. So, my first thing to say is a warning, right? This information is only accurate as of today. Things are moving through Congress, things are changing. There were things that were in the bill in mid-May that weren't there 3 days later. And so this is where we're at today, but I can't say where we're going to be at in a week or a month or 2 months, right? Important to know that the information shared that I'm about to share about proposals in Congress, these are just proposals, right? This is not yet the law. We don't know what the law is going to be when Congress finishes their budget. And so we're not at a moment where I think we need to be going and running out to the community and telling them, oh, this is the new law, right? It's not the law yet. We're going to try to do our best to make sure this does not become the law, because I think it's going to be very devastating if it does. Okay. I'm going to give a brief, I'm not good at doing anything brief, but I'm going to try to do a brief overview of the current law in very big picture, 30,000 foot terms, right? So the current law is that we have some programs that are very restricted, that only allow certain limited categories of immigrants to participate, and even have further restrictions sometime on how many years you have to wait, that kind of thing. So the programs that tend to be the most restricted under current law are Medicaid for adults who are not pregnant, so not children and not pregnant women, Medicaid for adults, SNAP or food stamps, SSI, which is a program for people living with disabilities, TANF, which is also called Work First in North Carolina, and this is the cash assistance program, and then FEMA cash assistance for people who've had their homes damaged by natural disasters. These 5 programs are the more restricted programs that are already and have been since 1996 available to fewer categories of immigrants. Then we have programs that are available to a wider group of non-citizens, okay? These include the Affordable Care Act, or Obamacare, healthcare.gov, right? This program, since its inception, has been available to a very wide number of immigrants, including people with U visas, temporary protected status, applicants for asylum, green card holders with no waiting period, so people who just received their green card, and many, many more, right, are eligible for healthcare under the Affordable Care Act. And so many people on this call and around this state have worked to make sure that those folks have access to healthcare under the ACA. Medicare, which is a program for elderly folks over 65. Now, we know that many people who are over 65, they may already have their green card, right? They may be folks who have gone through a process for many, many years of getting lawful status, and they're already a green card holder. But there are still folks in this over 65 category who are lawfully present and don't have green cards. I think about TPS holders from El Salvador or Nicaragua who have been here since the 90s in TPS status, right? Some of those people, if they were in their 40s in the 90s, they're now 65 plus, right? Asylum applicants, there are others in this over 65 category. And then, of course, Medicaid for pregnant women and children, which has been available to large numbers of lawfully present folks since 2010. Then there are a bunch of programs that are available to all with status or with no status at all, including undocumented people. So this includes emergency Medicaid for serious or life-threatening medical conditions. WIC, the Women, Infant, and Children's Nutrition Program, school lunch and breakfast, immunizations, free and sliding scale health clinics, and non-cash FEMA benefits. These are things like shelters, food in the immediate aftermath of a disaster, et cetera, and then disaster food stamps. I'm going to just cut us off at the chase right now and say that this list here, the programs available to undocumented people, is not implicated in the federal budget bill. So all of this will be the same. All of these will continue to be available under the federal budget bill to undocumented people. So this list is not changing. So this is the current law, right? We've got programs that are already heavily restricted, programs that are kind of medium level restricted, and programs that are available to all. So what is happening in Congress? Congress is in the middle of the federal budget negotiations. The House has already passed its version of the federal budget bill in May. And now the House's version of the budget bill is in front of the Senate. The two houses have to agree on all the provisions of the budget before it can become law. This is the bill that you might have heard referred to in the media as the big, beautiful bill, which is what President Trump is calling it. And it is loaded with provisions that have nothing to do with what we would consider budget provisions, right? So what does it have to say about immigrants accessing public benefit programs? The first one that is getting a major axe is the Affordable Care Act, Obamacare, healthcare.gov. Like I said earlier, we know that this law has enabled tens of thousands of immigrants in our state to obtain healthcare. The cuts to the Affordable Care Act in this current version of the bill are devastating. The only immigrants that will be eligible for the Affordable Care Act under this provision are green card holders, a very limited subset of Cubans. That's too complicated to explain, but it's not all Cubans. It's a limited number of Cubans, and migrants from Micronesia, the Marshall Islands, and Palau, which I have to guess many of us don't meet many of these folks on a daily basis. All other lawfully present immigrants would be cut out of the Affordable Care Act under this provision. We're talking refugees, we're talking asylees, we're talking asylum applicants, non-immigrant visa holders. These are farm workers, temporary employees, people with humanitarian parole. So we're Afghans, Ukrainians, Haitians, Nicaraguans, Venezuelans. I have a typo on my slide. It should say survivors of human trafficking there. It says survivors of human. We're all going to be survivors of humanity pretty soon. Survivors of human trafficking is what that meant to say. Survivors of domestic violence, both VAWA and U visa, people with temporary protected status, and DACA holders. All of them will be cut out of the Affordable Care Act under this provision. I don't have numbers of how many people this is in North Carolina, but I am certain it is in the tens of thousands. I do know this. I know that 975,000 people enrolled in the Affordable Care Act in North Carolina last year alone, or this year, excuse me, for 2025. I know that there's a data from 2021 that says about 16% of people who enroll in the Affordable Care Act are non-citizens. That number gets you to about 150,000 non-citizens enrolled in North Carolina in the Affordable Care Act. If that number is correct, that's the best number that I have. I don't know what percentage of those are green card holders, but I think we can assume that a lot of them are green card holders. But even if half of them are green card holders, that's 75,000 people who will lose health insurance under this provision. If 2/3 of them are green card holders, that's 50,000 people who will lose health insurance under this provision. So I don't have a statistic for you, but I believe that the number will be in the tens of thousands who will lose health insurance right here in North Carolina under this provision. And most of those people will not be eligible for Medicaid because they won't have the proper status. Medicare. This will go faster now because the provisions for SNAP and Medicare are the same as the provisions for ACA. They're going to limit Medicare, that is for people in the 65 plus category, right? To people who are green card holders, that limited number of Cubans, and migrants from Micronesia, Marshall Islands, and Palau. Everybody else cut out of Medicare. What is so devastating here are that Medicare is a system that we pay into through our paychecks, right? And so these people have been paying into the system for more than 10 years. Think about temporary protected status holders, other folks, right? Victims of human trafficking, people with VAWA, and they will not be eligible for Medicare. SNAP is the same. They're going to restrict it to green card holders, certain Cubans, and these few group folks from Micronesia, Marshall Islands. This will cut out refugees from SNAP. So we have people who have just arrived in the United States from whatever situation they've been in, living in a refugee camp. They will not be eligible for SNAP or food stamps in North Carolina. We do have data on this, and we know that in fiscal year 2023, 8,000 refugees used SNAP in North Carolina. None of them will be eligible if this provision goes through. Trafficking survivors, people who have escaped human trafficking, will not be eligible for SNAP anymore if this provision goes through, and survivors of domestic violence under VAWA. So again, these are some of our most vulnerable. I forgot to mention asylees as well. These are some of our most vulnerable immigrants in North Carolina, people who have fled persecution, who have fled human trafficking, who have fled domestic violence, and they will no longer be eligible for SNAP nutrition assistance if this bill goes through. The child tax credit provision, also devastating. The child tax credit provision is estimated to impact 4.5 million children nationwide. This provision will not allow a family to claim a child tax credit unless both parents have a Social Security number. It does not matter whether their citizens will be US, or their children, excuse me, are US citizens or not. They will not be eligible to claim the child tax credit. This will impact, I'm certain, tens of thousands of children in North Carolina. We're working on getting more data on that. And will drive people to, I believe, food banks and other services where they will need more assistance because they'll be losing child tax credits worth thousands of dollars to their families. The Medicaid proposal is complicated, and please bear with me. There are no cuts to Medicaid in terms of status. The bill does not cut out refugees from Medicaid. It does not cut out asylees from Medicaid. There are no particular eligibility cuts for Medicaid under the bill. Some of you may have heard that it was looking to cut pregnant women and children out of the bill of Medicaid. That used to be true several weeks ago. It's no longer in the bill. So I want to make that clear. They are protected under this version of the bill that currently exists. What the bill does say is that if the state offers Medicaid to people with humanitarian parole, which is in our state a lot of Afghans, Ukrainians, certain Venezuelans, Nicaraguans, Cubans, and Haitians, that the state overall, not just immigrants, but the whole state, will receive a 10% cut to the federal matching funds that we use to fund Medicaid expansion in our state. That means North Carolina has a trigger law, which means that if we do not receive 90% federal matching funds from the government, we will no longer have Medicaid expansion in North Carolina. This provision would cut our funds to below 90% to 80%, and it would end Medicaid expansion in North Carolina for everybody, citizens and immigrants alike. All the 600,000 people that use Medicaid expansion in North Carolina would lose coverage. So what we are trying to figure out right now and I wish that I had better information for you as of today, is whether North Carolina can cut parolees out of Medicaid coverage. It's not a lot of people numerically in North Carolina. We're not talking about tens of thousands. I think it's probably in the single digit thousands, if I had to guess. I don't have good data on it. But it's not clear legally whether North Carolina is allowed to exclude parolees from our Medicaid coverage because they're eligible for it. They're eligible under federal law. And it's not clear yet whether we're allowed to cut them out. And I don't have more information on that today. The national experts are working on that right now and trying to figure it out. This provision arose hastily in a late edit to the bill, and it's poorly written, and everybody's trying to interpret it right now. If North Carolina can cut parolees out of Medicaid, that means we'd lose several thousand immigrants in the state would lose coverage under Medicaid, but life would move on for the 600,000 people who have Medicaid expansion. If North Carolina cannot cut parolees out of Medicaid, our Medicaid expansion program will end in North Carolina unless the state does something to save it. So this provision is both unclear, confusing, and potentially extremely devastating to healthcare access in North Carolina. So that is what I have for substance, and I'm going to turn it over to my coworker Stacy to talk about how you can help, because we really, really need the help of everyone in this call at this moment in time.
Thank you, Kate, and thank you also for giving us the opportunity to speak here. I just want to start off by acknowledging that I understand that myself coming here and asking you to take action as not someone who is an immigrant, as a white woman. I just want to acknowledge that and just let you know that after I share a few details with you, I'd be really interested in hearing your feedback and your response to the kind of communication strategies that we've come up with here at the Justice Center to help influence this policy. Kate provided so much up-to-date, important information about this issue, and it's all important to know. And it's also important to tell the human impact of these stories, because that's what sticks with people more, whether we're telling our friend circles, telling our partners, sharing on social media, having a meeting with legislators to talk about this, or creating an appeal for legislators. It's so important to really bring it down to like what this impact is, and how it's being kind of the themes of like what does this mean? What are the values here? How is this impacting people you know, your community, your family, your neighbors? So I think some of the key points to retain and to incorporate into messaging, if I could just take a moment to kind of recap what Kate had shared, is the provisions in this budget reconciliation bill, also known as the big beautiful bill, unfortunately, a misnomer there. It is the federal budget proposal that is in the process of being considered in Congress right now. It's before the Senate. They're expected to move on it fairly quickly, like within the next month or so. And so, as Kate had mentioned, in addition to just budget items, it's really being used as one of many tools to isolate and target the immigrant community. I think a key point to highlight, while also highlighting it in the right way, in a just and inclusive and sensitive way, is these provisions are not only designed to or going to have an impact on people who are undocumented or people, and I don't think it's useful to like categorize people by status in that sense, or say that there is a priority for people who have status versus who don't when it comes to human rights. But also, I think it's a key part of the narrative, because I think people are just assuming that this is something that is exclusively impacting people without legal status, and it's not. As Kate explained, it's really targeting and going to impact even the most vulnerable people that these programs have been set up to help, including refugees, asylees, and human trafficking survivors. Many of those groups may overlap to some extent or another with the immigrant community as well. Well, of course, refugees and asylees are pretty much all immigrants. So just making sure that the key facts are out there, that people should know why they should care. But it's also important to put the human aspect on it, and that's why we're here today, Kate, to inform you, and also me to help support the story collecting aspect, which was also Kate is the driving force behind this and has put together these forms in both English and Spanish. So I'm here to tell you a little bit about what the kind of stories we're asking you to share, and kind of how those stories would be used, and to invite you to share your feedback and any questions you have. So there are a few different ways these forms are incorporated into these slides, and when I'm done speaking, I can also include the links in the chat. But there is an office form here that you're able to submit text through. You can also access that form through a QR code as we move through the slides. But if you are a part of an organization or a service agency that serves the immigrant community, we're asking you to tell us how the proposals to cut off immigrants of all different types of status from public assistance, which would include the subsidies, as I understand from what Kate had just mentioned with the latest update. It would include subsidies or even ability to enroll in the ACA coverage, which means that people will be losing their health insurance coverage, the ability to get food assistance, also known as SNAP, or food benefits, nutrition benefits, and the ability to claim the child tax credit, which is equates to quite a lot amount of money. I think it's at least $2,500 in tax credits per child, impacting people's take-home pay. In addition to that, and it is quite complicated and nuanced, but it's also very important to clarify in a very concise way, is that the way the bill is structured and in the provisions that it has endangers Medicaid expansion overall, because of the way our state's Medicaid expansion bill was written. And again, not only for immigrants, but for anyone who is covered under Medicaid expansion. Yes, so we're asking if you can, to share stories through these forms. We're also, and I'm going to kind of get into this on the next slide as well, we're also very interested in providing support as far as like doing interviews with people who would like to share their story as well. We're looking both from people in organizations that are serving the impacted communities, as well as impacted people themselves, about how the proposed loss of healthcare coverage, food assistance, child tax credit would impact them or their communities. I wanted to highlight that it's very important to us to preserve anonymity, meaning anyone who shares their story, and we can also use and share stories that you're sharing on behalf of other people, such as perhaps like clients or family members. We just, of course, would ask that you gain permission from that individual to share their story, even if they're, not being named in a way that identifies them, just making sure that you have their permission to share it. But we've done these types of efforts before, and we'll protect anonymity. People can use just their initials, just their first name. They can use a pseudonym. we want to make sure that people feel comfortable and that not feeling like they're putting themselves at risk for speaking out. I have put a deadline on here. I'm not sure if Kate's, I will defer to her if her deadline differs. I do know that we want to start putting these stories out there to start influencing the narrative as soon as possible. And Kate, if you could advance to the next slide.
And I would say my deadline is as soon as possible. we really need folks to weigh in. But yes, I will advance.
So the Justice Center has done a similar project to what we're proposing here last year. We put together, the Health Advocacy Project put together a printed storybook that on Medicaid expansion and how that's impacted people across the state. They collected, I believe, probably over 100 stories, and I've included a link. This link is clickable when you get the slides to the storybook online, and this is just a screenshot from one of the pages, and it gives you an idea of, first of all, of preserving anonymity. So people only used a first initial in their county here. Submitting pictures is completely optional. We understand that pictures are not required at all. I talked a little bit this morning with Rebecca Cerise on our team, who put together this storybook, and that the Health Advocacy Project is going to support the Immigrant Rights Storybook as well, about the goals of this. And I think she clarified them really well. Like, why do we want to collect stories? Why do we want to share stories? And I'll also talk a little bit about how those stories will be used. The main goals are shifting the narrative around the anti-immigrant provisions, letting people, calling attention to what's happening, naming the attacks and the coordination of them, but also really embedded in that, is dehumanization of immigrant people. And the goal of sharing something like this, something that's personal and specific and laid out in human terms, is resisting that dehumanization by sharing these stories and the human impacts in real terms. Wanted to underscore again that anonymity would be protected. We won't be sharing anyone's name or image or even organization without their express permission to do so. And very happy to share stories with only initials, like you see here in the examples. And the primary way we like to deliver this is in a printed storybook, similar to what you see here in the link that you'll find online, delivering it to legislators, which would be members of Congress for this particular bill. Also potentially, when only with the storyteller's permission, potentially sharing the stories, and again with the anonymity that the person wanted to preserve on social media, potentially serving if someone is interested as a spokesperson, meaning a potential media contact, which could be anonymous as well, or even a speaker at a press briefing. And none of that is required. I just wanted to highlight that there's multiple ways and levels to participate, with like the easiest level and hopefully even getting started today level of opening that link of the forms that Kate has collected and entering some information there of what you would like to share and why you think advocating against these provisions is really important. Just wanted to add as well that, we are more than willing to support the storytelling, meaning, of course, we'll be working with any content we receive through the form to write the stories or present the stories, but also wanted to know that we're willing to interview people over the phone, coach people through, I think what happened to me, or how, is really important, but I'm not really sure how to share my story. Just willing to meet with you individually and walk through that and guide you through that. And wanted to stress the just importance of rapid response and acting soon on this, as Congress is moving soon on this, quickly on this as well. And Kate, if you could advance to my last slide, and then I'll wrap up and see what questions and comments we have. So yes, so there's the QR codes for both the Spanish language and the English language form. I realize I'm probably speaking. I have a note to myself I just saw about speak more slowly. I know I speak very rapidly, so apologies for that. Um, I'm hoping that we can spend a few minutes hearing some feedback, hearing any stories or that you would like to share here with the group, and any questions you might have. And also,